Aloha. So today is vlog number 15. So now you might be curious how Chrissy is doing. So there's a few things that popped up today, and today's date is December 19th, 2025. So today, this morning, um, so I was sleeping actually. So around, I finished work, it was around 3 in the morning, settling down, finally started knocking out around 3 a.m. My wife Chrissy was also sleeping. And then later around, I would say 6 in the morning, Chrissy flashed on and off the lights, and I was like, oh shoot, what's going on? What's the matter? And Chrissy was like, oh, come over here, I need help. And at first, I was confused. I was looking at the time, and I was like, well, it's 6 o'clock. My work is usually at 7. We're 1 hour early. Okay. I got up, I walked to the living room, I looked around, but no one was there. And then I realized, oh, she's in the bathroom. So as I head over to the bathroom, she explained to me, hey, I am feeling dizzy. I'm feeling out of it. I'm about to pass out. I'm just letting you know. And so I'm like, oh, shoot, just like before. So I met up with her in the bathroom. I'm consoling her, taking care of her. We finished up in the bathroom and she got up. And as we were walking to the living room, all of a sudden her body kind of crumpled, as if she was jello. And her breathing became shallow, became labored. She was having difficulty breathing. And I thought to myself, oh shoot. So I'm trying to let her down gently. However, her knee landed on my foot, and I was like, it hurt. But most important that is she's not going to hit anything on the floor or around her. But she kind of slumped down to her knee and then onto her side, and I'm kind of like bringing in her legs so she can kind of cuddle up on the ground. And I'm telling her to mind her breathing. And so that lasted around 15 minutes of her just being on the ground, breathing like that. So after 15 minutes, we're like, okay, ready? I'm lifting her up. She's trying to get up. She crumples back to the floor. Her breathing gets worse. It becomes more labored, more shallow. So I become concerned. So I actually send a text to our oncologist. So I shoot a message to the doc and I say, hey, what's going on? I'm concerned with this situation. Every 3 weeks, this happens again and again and again, usually 1 week after chemo treatment. And the oncologist responded saying, yeah, you got to go to the ER. So we went around 8, we arrived around 8-ish. So by the time we arrived in the ER, we got admitted, yada yada. We did some tests, we did CT, a heart EKG, we did some blood work just to check if there were any other symptoms that were present. Hopefully we could discover or determine why she kept passing out, blacking out. Because it's been a long time that this has been happening, actually, over the span of 6 months, and it happens again and again and again, right? So we were trying to figure out what's going on. Is it maybe a heart issue or is it something else? And so after a few exams, a few more tests, they discovered that she actually had an area that was impacted on the lower right of her body. Um, in the medical term is actually pulmonary embolism. Embolism. Essentially, a pulmonary embolism is a blood clot. It's not nothing too major. It's a small, tiny clot. Um, but they requested that Chrissy spend an overnight just for observations, just to make sure she's all good in the hospital. And so they transferred her to a different room, and she's still in the ER, but it's not the nicest room. The lights stay on the entire time, so hopefully she's able to get some rest there. But yeah, I just got home. I'm resting. I'm gonna head back to the hospital to check up on her tomorrow. But yeah, the doctors discovered and decided that, for the rest of her life, she's gonna have to be on a regimen of blood thinners. Starting this week, she's on 10 milligrams. And then after that, I believe next week or yeah, like 2 weeks, she's gonna go on a regimen of 5 milligrams twice a day, for the rest of her life. And I guess that is part of most cancer patients' regimens, right? Is that they have a lot of blood clot issues, and so they have to take blood thinners. So that means tomorrow morning, we're gonna check up on her. They're gonna do another heart test. They just want to make sure her heart is okay. The doctors want to check that there's no murmurs or anything else that'll be causing her any issues. So they're gonna, figure that out tomorrow. So yeah, that's where we're at today. That's where my wife is. She's in the ER, spending an overnight. So that, you may be wondering, oh, um, how's our Ohana? Chrissy was really planning to do holiday photos, and we were getting ready for that, but got that all got thrown to the wayside, especially with her grading. She was preparing on working on some of that, but that's on a delay. But just keep us in the back of your minds, right? That she's okay. She's still strong. She just has a few other things that are popping up in the moment. So, yeah, I just want to keep you all updated on where we're at, on where she's at. So, thank you for your time. All right. Okay. Love you all.